Lazy dog. Well, welcome to the 7 o'clock talk. And no sooner did we start than that one came over. Doesn't do this normally, but
Only
there
on
she is.
Tuesdays
Oh,
at
look at her.
7.
Squinty eye. Can't see me. Can't see me. Oh, hi. We also have another one that joined us. This one's finally being let in. Somebody feels guilty because our other one died. So tonight, I thought we would take a little time. And the first thing we're going to talk about is we're going to talk about brain health because that seems to be getting a lot more press. And, rather than go into the testing of it all, are your readings anthuric acid, blah, blah. Organic acids kind of show us neuroinflammation and things like that. We're going to talk about ways to help improve your mental health, and they're free. So this is the best type of thing. And so Jess and we were talking about it before. And what did you say that people should be doing?
Oh, like Sudoku and brain teasers,
And so anytime
memory games.
you're learning something new, you're challenging your body, you're challenging your mind. It's just like any other muscle. The more that you challenge it, the stronger it gets. And when you're challenging your mind and you're learning something new, you're trying something new, then you're releasing a hormone called BDNF, brain derived neurotrophic factor. And that allows for plasticity. And we know that in neuroscience now that the brain doesn't stop learning and doesn't stop growing and it doesn't lose its elasticity if you don't exercise it. So you wake up in the morning, you eat your breakfast, you put your boots on, you go to work, you eat lunch, you finish up your job, you come home, you do odds and ends, go eat your dinner, and then you go to bed and rinse and repeat. Well, then the brain does atrophy because you don't have to think about what's going on and what's happening. And so when you do Sudoku and you do crosswords and you do memory teasers and you do all of this stuff, you're exercising your brain. Just like if you go to the gym to exercise your arms or your legs or whatnot, you have to exercise your mind. And that's one of the best things. Watch a movie that makes you think or gets you engaged. These are the things that you can do that are free, that are super easy. Going out and just doing physical exercise, that helps a ton because that also releases BDNF, and that's just like brain fertilizer. So, and why do we do this? Why do we do what we do?
Oh, so we can help people live better lives.
And that's the biggest thing about all of this is it is to live a better life. I lost a grandparent. Actually, my mother was thinking she was getting Alzheimer's and dementia, and my grandmother actually had Alzheimer's. And so, doing deep dives
No,
into the genetics of
no,
it,
get down. Get back.
she wants attention. I'm going to sneak up onto the couch. Why do you let that one on the couch, but you don't let me on the couch? Just the things that happen. But anyway, we want everybody to live their best life. And that kind of leads us into the next part of this, which I talked about, which is what's the difference between allopathic and functional medicine? And I've been asked this a lot, and I've thought a lot about it because there really are no good definitions. But we can tell you the definition that our best patients fit and the ones who get the best results, what they fit, because I consider allopathic medicine to be passive medicine. The doctor does something to you. The doctor prescribes something for you. You just take this, and that's the only thing that you pretty much have to do. You might go see a nutritionist. You might go do something else, but I mean, do you think that's a fair assessment, or am I being a little too harsh?
That they're not very engaged. I
Well,
would say,
not that the doctor's not engaged, because he wants the best for his patients. I'm not saying that that's not what he wants. I am saying that allopathic medicine is very passive medicine. It's the difference between the person that goes to the gym and
yeah, they're
exercises
not
doing chiropractic, or they're going to see me and they let me adjust them, and then they let me put them in the chair.
a lot of them don't seek very deep,
So
but then you have some really awesome ones that do.
yeah, and that's where the things that functional medicine does. I look at functional medicine as participatory medicine, because you're going to, when you come to us, you're required to do things. We don't just do it all for you. I mean, we do research and we do look up things, and if you have genetic stuff, we try to figure out what's going on.
We give you homework.
Yeah, you literally do have homework, and it's not go see this practitioner or that practitioner, because everybody has their little niche in allopathic medicine, and it's just like what we were just talking about, the brain. If you have dementia or Alzheimer's, they're going to maybe tell you to do Sudoku and do a puzzle, but they're not. And they might have somebody tell you to exercise,
Well, I think of it like,
but they're not going to really dig into the nutrition and to the anti-inflammatory diet, and to really sitting down and educating you on how this is supposed to happen for you and why you should do it.
well, there's no gatekeeper there. So there's somebody knows your heart inside and out, and somebody knows your gut inside and out, kinda. The neurologist knows your brain and how it works, but they never talk to each other.
Yeah, they don't all sit around the
They don't.
table.
They don't look at you as a whole and let's look at the brain and let's look at this and let's look at this and let's figure it all out why it's not working for you. They just, this person looks at this and this person looks at this and they write their notes, and that's where they kind of stay because nobody ever really puts it all together.
Now, your pharmacist will have to make sure that your medications don't,
Interact.
cause problems, but your doctor doesn't really do that. That's to the pharmacist, and that's where we look at things, and they all.
And I think that's where you have to engage them, because I started out with a primary care physician, and my first visit I got 3 more referrals and a handful of scripts if I wanted them, and I frustrated that person because I didn't want the prescriptions. I wanted to know what the problem was so I could fix the problem, not medicate the symptom. So as we've walked through over the last couple of years together, she kind of knows that I'm going to look at all of these tests from all these other doctors, but I'm going to filter them back to her and be like, okay, what do we think about this? What's our next step? But that's me engaging and and wanting something different. But
The problem is,
I shouldn't be the one having to engage a conversation.
the difference in that is you're doing that to educate her. You're not doing that.
Yes, but I really believe that she will be a better doctor because of it. But the good thing about that is she opened her mind to also learn
Mhm.
as well as share. And I and when I was little, when we and I'm sure a lot of you, when you went to the doctor, you didn't get a referral like you went to Dr. Smith, and Dr. Smith took care of your heart, and he took care of your stomach, and he took care of your arthritis and your earaches and all the other things until something really scary came up, and then you got something.
Then you went to the specialist. Whereas now, what we do, anything that we do, the side effects, we don't use medications. And so the side effects generally help build the body up. There are very few negative side effects to what we do. And that's all to your benefit. And then the other thing about this is it is participatory. You are going to have homework, and you're going to know why you have the homework. And those patients of ours, I mean, honestly, we can sit there and go through. The funny thing is, we actually had a patient drop us, and it's absolutely amazing to me because the patient has been to how many other practitioners?
Oh, dozens.
Has been to dozens and dozens of other practitioners, has not seen
And
any.
by her words is, they have done nothing for me.
Uh-huh. And so now we have cut her symptoms more than in half. She's gone from 90 some odd down to like 20 to 30.
And says, I feel so much better.
She feels great, and she wants to jump into the next phase of care, and she hasn't given her gut enough time to actually heal.
But then she also doesn't want any follow up.
Yeah, she doesn't want to do the multiple symptom questionnaire, and she doesn't want us to track her health.
She doesn't want us to do the BIA.
And
She doesn't want to do office, she doesn't want to speak. She just wants the protocols with no guidance or
accountability.
yeah, and we don't work like that.
Well, the reason why we do a BIA, and I mean, everybody has the tools that they like, but we follow that cellular health because if we're not making a difference, we know we have to change something. Every test that we do, we tell you why, and we go into it. And it just amazes me that somebody would throw away the best thing that has happened to them so far because somebody's saying, be patient and
Give your body
let your
time.
body have time to fully recover. Somebody has tea for us. Well, thank you.
And we are willing to walk with them.
Yes.
And we are actually invested in them. But they just want the protocol, and I'll do it myself. But I mean, and that's great, but that's not.
And I outlined it for her.
We can't work like that because we have to be able to watch, make sure that it's working the way it's supposed to be working, so that we can guide it if need be.
Well, yeah, because
you have to have some accountability on both sides.
And there's a thing that goes with the accountability and all of this, that when we sit down and we explain the tests, we go over how we're going to do things. But it's just like we had a patient who was sensitive to monk fruit. And if we weren't staying in touch with that patient, then we wouldn't have known. We have a patient that's sensitive to sucralose. And she's a bodybuilder. And so when the patient is not figuring this out, we have to look at the diet diary and we go dig into that, and we start to look at the ingredients of the diet diary to figure out what's causing the problem.
And that takes a lot of time, but we are just we're just as invested in somebody and their results as they invest in us.
Yep. And when we sit down with you, and the reason why we sit down with you so we get to know you, what your habits are. And so as we do that, then we get to sit down and we get to go, oh, hey, you know what? We've seen this before, and you may want to change this. You may want to do this. So we have a person saying that they have flowers. Let me put that up there. They have flowers for neurodegenerative diseases. And that's very cool. Do you know why? That's what we talk about, is why. The reason why some flowers and plants and those things are affect neurodegenerative diseases and stuff is because the body needs the polyphenols and the bioflavonoids to run the immune system. And that's just what we mean when we sit here and we say, we want you to know why. Because when, let's face it, life is going to happen. And we're all going to go on a cruise. We're all going to go on vacation. We're all going to go do something that gets us away from the straight and narrow path. And then you start to feel like crap. And all you have to do then is go back onto your training and figure out, oh, okay, well, I need to do this, this, and this. This was happening. And this is what we did. And then you can clean yourself up. The object for us is not to have lifelong patience. The object for us is to train you on how you can take care of yourself. So I'm very passionate about that. I'm so tired of people giving their health over to somebody else. I don't want your health, and I don't want to be responsible for your health. I want to educate you on how
Well,
you can take care of
yeah,
yourself.
empower other people to do the things to actually create a change in themselves and not just pop a pill or a supplement every day. For instance, we have a lot of spouses that follow along. So they're not actually our patients technically. We've never done a lot of testing on some of them, but we still allow them to walk the journey. So they're basically following the things, that their other spouse is doing, because they change their lifestyle. They change the way they cook or eat or whatever. They are able to get access to wonderful um, supplements and
Supplements that work.
well, and they just change, their world changes a little bit, but we're not giving them anything. We're not doing anything different for them, but they listen. And for this one gentleman, he comes in and he's with his wife and he's sleeping 3 hours a night, and he's got some issues with probably some hormones things.
He did let us do one test on him. We ran a test.
So we knew he had issues with hormones, but we don't really go in depth. We don't do the core testing or anything. And are 2 months? They've been two, maybe two, at least two, maybe three, and he is sleeping 7+ hours a night.
Yep.
And that is unbelievable, because, and why that's important is we did nothing different. Like, we didn't give him a pill. He's on some wonderful supplements. He hasn't really changed his exercise habits because of job, but he made himself a priority, and we explained to him why sleep is important. We hear that, oh, I'll sleep when I'm dead. We say that a lot, but sleep is so important because you create your hormones and your things that you need for the next day while you're sleeping. And so he's feeling really good and he looks good, and together their relationship is healthier and it's just vibrant, and they genuinely seem happy. And that was not created by us.
And think about this. There's a saying that goes, I'm not here for a long time, I'm here for a good time. And the funny thing about that is the body is actually designed to adapt and overcome. It has many redundant systems. And you're just not going to die. If you don't take care of yourself, the decline is going to be this long, slow decline. If you are healthy and you're taking care of yourself and you're doing the things that are good for your body, that we call that the squaring of the curve. Then you're going along, and then you're just dead. So let's see, we have some questions here. Have you ever heard of the land lotus? That one I haven't heard of. Periwinkle and tyrosine, yes, because those help the neurotransmitters. So when we start to look at testing for the brain, We do an organic acids test, and so we do look at the neurotransmitters. I don't find that just dealing with tyrosine by itself seems to be very advantageous. But when you're giving it with periwinkle and you're giving it with other polyphenols and other bioflavonoids, think of bioflavonoids as colors. When you give the body those colors, you're helping boost the immune system. Plus, if I remember right, those also affect the hormones as well. And typically, things that are good for you, they affect everything. They don't just go, like medications are designed to work on one pathway and they work on inhibition. Most natural medicines of the like, they work on multiple pathways and they boost things. Well, it sounds like you have all kinds of cool stuff, and you'll have to throw a link in the talk here so we can check it out. And with that said, we've gone a little over. We've enjoyed your company, and you have a wonderful evening, and we'll see you all. Yep.
Yep. If you're local or you're close, I am very passionate about my old people. I love old people. Old people they just calm me. I love sitting with them. I love loving them, and I always want to give to them, but I get so much more from them than I probably give. Um, but this Christmas, and we did it last Christmas, we have adopted a nursing home in North Vernon. They have 115 residents. They are just lovely people, and they love little things. So we've decided this year that we are wanting to fill their um, rooms with color and comfiness. And so we are doing a blanket drive and hoping to get a blanket for every resident. And we are collecting those through the clinic. So if you're local and you would like to help us, we would love to accept your donations, either money if you don't want to shop, and I will shop for you, or if you want to stop by and visit us and bring us some blankets. Um, there's 115 residents, but our goal is 150 because we would like to help out some other groups that go out and seek out people that are homeless, that are cold.
So that's our blanket drive, and we're looking forward to hearing from you. We already have quite a few donations. We have a lot of cash to go shopping with. We appreciate it, and you all have a wonderful Thanksgiving. Good evening.